Good afternoon and welcome to today's webinar titled Preparing for the API Revolution in Healthcare, presented by Healthcare Innovation. My name is Rajiv Leventhal. I'm the Managing Editor of Healthcare Innovation. Today's program is sponsored by Change Healthcare. Thank you so much to our sponsor and to you, our audience, for giving us your time and attention today. Before we get started, we do have a few housekeeping details to go over. First, to submit a question, please use the Q&A box to the left of your video window at any time. You do not have to wait until the end of the program to submit a question for our speakers. For technical issues, please press F5 to refresh. And if that doesn't work, you can submit a question with your issue through the aforementioned Q&A panel. We also encourage you to join our discussion on Twitter today, and you can do that tweeting using the hashtag HILiveWebinar. With that, I'd like to introduce our expert speakers for today's program. We have with us Gautam M. Shah, also referred to as G, who is Change Healthcare's VP of Platform and Marketplaces. He leads the organization's digital transformation. We also have with us Adamvardikar, who's a CEO and co-founder of PatientPal, a company started in 2018 to automate the most tedious and time-consuming aspects of managing a radiology clinic. With that, we will start with a G to kick it off. G, the floor is yours.
Thanks, Rajiv. And as we're clicking the slides over here, first of all, before we start, we hope everyone is safe and well and starting to engage in what we think about as the new normal, and which also means I hope everyone's getting vaccinated. So just a little bit more on that introduction. Again, G. Shah, I'm responsible for platform and marketplace at Change Healthcare. And what that really means is I spend my entire day thinking about how we can change the way that we develop and build solutions in healthcare, how we can help drive better outcomes for patients, how we make lives of providers easier, and how do we make the efficiency of the system easier for payers. And in taking this life cycle integrated perspective, we've come up with some insights and some ways of thinking about how we should drive innovation through the healthcare ecosystem using APIs, and we'll share a little bit about that today. But before we jump in, let me pass it over to my co-presenter, Adam, who I'm super excited to be presenting with because he's got some great insights and also some great practical examples of how we can talk about innovation in healthcare. Adam.
Thanks, G. My name is Adamvardikar. I'm the CEO and founder of a company called PatientPal, Inc. And, you know, I actually have a kind of a fun story, the way I got here. It's not the kind of esoteric, I experienced a problem and made a solution. It's much more personal. My parents are actually both physicians, and they own their own outpatient imaging center in Boston. It's kind of a throwback to another time when doctors would own their own practices and not be owned by a large hospital or something. And I worked there growing up. So I worked there all through high school, all through college, after college. And I did a lot of the administrative tasks that, tens or hundreds of thousands of people around the country do. As I got older, I kind of noticed, we're doing the same thing over and over and over and over again. There's a world of variation, but it is a finite world. There's a finite number of insurances, a finite number of rates, a finite number of intake questions. So eventually, after just being very frustrated with this problem at the family business, I recruited a brilliant co-founder, and we set out to automate the entire administrative process in medical facilities, as we say, from clipboard to claim. And I'm excited to talk more about that as we go.
Thanks, Adam. So before we jump in, let me just give you a sense of what we're going to talk about. We're going to start by talking about the opportunity. And there's a varying level of understanding of APIs, how they power healthcare innovation, and really what's coming at us. So we'll spend a few minutes talking about that and laying the foundation. We'll talk a bit more with Adam about how he and his company have used APIs to drive innovation into their system, to really create the kind of efficiency, as he said, from clipboard to claim, that allows us to unlock the better experiences and the best experiences that we can have and the best outcomes we can drive. And then finally, we'll end on the note of execution, because it's always fun to talk about what can be done, but how do you actually do it? And so we'll give you some practical ideas on how you can start thinking about the use of APIs to help drive innovation in your particular areas. But first, let's take a big step back. What's happening in our industry, and why is this the right time for us to be having this conversation? Well, first and foremost, regulation. Between the 21st Century Cures Act, the CMS Interoperability and Patient Access Rule, and all the things that surround them, it's becoming very clear that although we've been talking about APIs forever, we're finally at a place where we actually have to start using them. And therein lies an opportunity. Because we're being mandated to take the steps to use APIs, to create experiences, to drive data transfer, we now have a platform. We have a place to operate from that says, hey, we can do something more than just make some data go back and forth. We're doing that, and we can do that because the other force here, consumerism, is hitting us full bore. This happened before COVID. All of us as healthcare consumers and healthcare consumers in general, we're spoiled. We're spoiled by all the other types of experiences that we have in the world. And we want to have our healthcare follow those experiences, but we can't. Now, fast forward through COVID, where everything's been virtualized and you can't really go do what you normally do. It's been a great shot in the arm, no pun intended, for this part of the industry where we can create great consumer experiences for patients and make it easy for our providers and for our payers to actually engage in those experiences in a way that ultimately delivers great outcomes. There's new models. We talked a little bit about what COVID did to the ecosystem. Think about the amazing growth in telehealth and what that did from a virtual perspective, and how now we can look at true virtual care, not just from the perspective of what are we doing here and having a conversation, but how do we create a full virtualized experience? And Adam's going to talk a lot about that. And finally, technology marches on. And how do we start to take advantage of the fact that we have more technical capabilities every year than we did the year before? And there's a growing need to actually engage with those technical forces, or that technology evolution as we go. Now, that's the good stuff. The bad stuff, unfortunately, is we are just held back by a few things. Data. The data is fragmented. Less than a third of all the data that we use every day can be exchanged easily between the various different pieces of our system. And we live in a distributed system. The liquidity of the data is so fundamental, and we have to find a way to solve for that. Because of that, the system is inefficient. And you talk about inefficiency at all levels. How long does it take to get an appointment? How long does it take once you get the appointment to fill in your information? What do all the back office systems look like that you have to go through to get to the point where you actually get a patient in front of a provider, whether in person or virtually? And so we have to solve for that, because the efficiency in the system not only drives cost, it drives issues of access, it drives issues of quality. And so we have to be able to get past this idea that we're wasting money, we're wasting time, and we're wasting effort. And bad debt, right? The system runs on the ability to ensure proper financial settlement and payment back and forth. The wasteful spending, the fragmentation of data, all of these things contribute to a set of bad debt that makes it hard for the system to operate. So lots of promise here on the left side of the screen, lots of technical challenges and process challenges to overcome on the right-hand side of the screen. So how do we go about changing that? Well, first, we need to take a quick step back. And let's think about how we solve problems in healthcare today. And I'll propose a model here, and we'll talk a little bit more about it at the end of the conference here, where let's start thinking about systems of data, systems of experience, and systems of engagement. Where does this data live? How does the data get turned into something useful? And how do we present that data to people that are going to use it, whether it's a patient, the provider, the payer, someone in the back office, a caregiver, whomever. And in thinking about that, we recognize that this is our system. It's a continuous care model. We start with finding out about our care and go all the way through to a continuity of care model, and then we start again. But the problem is all of this data is locked up in all of its various different places. So we cannot get to a place where it's seamless. We can't get to a place where, and I'll give you an example that I'm sure Adam's going to reinforce later on. I recently went and got an MRI. I filled out the clipboard 3 times. I went in and talked to the person behind the front desk and had to have a full conversation about all the information that I had filled out online beforehand, or I'd filled out on a piece of paper and been faxed over, not saying anything more about faxes, from my provider to that diagnostic imaging facility. We cannot create the kind of experiences that we want to provide to our patients, to our providers, to our payers without having liquidity in place. And that's how we have to think about connecting up the systems of data. Once you do that, the systems of experience and the systems of engagement really start to come to play. And this is where we can think about innovation. Once we've unlocked the ability to get all the key pieces that we need put together in one place, so we can think about less about, well, how do I get that data and how do I ensure that it's the right data, and more about how do I create that next great experience? How do I create something seamless that gets the patient to where they want to be, gets that provider to not be burned out and be able to take care of the patient in the right way? So ideally, we want to get to this state where everything is connected together. And I know there are those of you in the audience that are saying, okay, G, yeah, someday, right? Someday we'll get there. And that is a very true statement. Someday we'll get there. But the time to get there is now. The time to start innovating is now, because again, we have a platform to start from. We have a set of regulations that are going to drive us to do this anyway. We have the impetus to start using APIs in ways more than just, let's get some data back and forth. And we have the opportunity, thinking about developing our solutions and engaging patients, providers, and payers in the right way, to really make a change. Now, I'm going to say COVID for the last time here, but if there's anything that's going to drive this, it is the fact that we've learned through this pandemic that we can do this. Between the CARES Act, between the rise of telehealth, between the broader virtualization of care, there are innumerable examples of how we can virtualize care, we can use APIs, we can make data flow. So the bar is lower, the proof points are there, and ultimately the technologies and the ways to do it exist. And what I'll do now is I'll talk to you a little bit about how this is being seen in the industry based on some research that we've done, and really start to form the platform, right? The underlying information that says, how do we take these steps forward? Before I do that, though, and it's something we like to do as we go through these discussions, we'd like to poll you. Give us a sense of where you are in your journey. Tell us how easy it is for you to get data to create the kind of seamless experiences we want to get to. And I'm going to go over here and launch this poll. If you can spend a few seconds answering that, and we'll go back and we'll see what the results are. I think I have to go here and do that. There we go. So while we're getting those poll results, let me tell you a little bit about why we're so passionate about this and why we're talking about this. So Change Healthcare is one of the largest independent technology companies in the US. We transit clinical transactions, financial transactions, operational transactions. We have a portfolio of products that cover that whole patient journey that we talked about on that previous slide. And our business is based on connectivity upon data and upon the ability to take those two things together, turn that information into an insight, turn that insight into an outcome that we can then deliver to our end users. So we have gone all in. We are 100% committed to the idea that using our products based on the use of the APIs and making those APIs available is how we solve these problems. And we're not doing that for everybody else. It's just as, hey, we're a service provider, here's some APIs, go to town. We do this ourselves. Every API that we create is an API that we use in our product ourselves. So we dog food or drink our own champagne or whatever analogy you want to use with the APIs, because we believe that this is the way that we're going to drive our own innovation. And this is how we're going to drive innovation across the broader ecosystem. And that is our platform that we use to have this conversation and do research and really help everyone understand the opportunity. So before we go on, let's take a look at what these survey results look like. So it looks like about half, a little more than half of everyone said that getting access to this data is somewhat challenging. The next big cohort is extremely challenging. And then everyone else is, okay, it's sort of easy. And again, this is what we expect to see, right? Because we recognize the pipes, the connectivity, the modalities, and the thought processes don't exist in the system. And I'll say this before we go on. It is hard, if not impossible, to innovate, to really get to the value propositions we want to, when we're spending all of our time building foundations, building capabilities, building scale, instead of thinking about how do I best serve that patient? How do I best serve that provider? How do I best enable that payer? So what are we going to cover next? Let's talk a little bit about the strategic importance of APIs. And again, we'll do this based on some research. We'll talk a bit about maturity in the system, again, so you can gauge where you are. And then we'll cover two very key topics, because these are the things that drive usage and drive scale: security and performance. So start with the research. So over the last roughly 9 months, we've conducted a pretty deep set of research studies just so we can help have this conversation. And the reason for this is twofold. One, you talk about APIs, and if you're a technical person, you're like, yeah, I got you. Off we go. If you're a non-technical person, in some cases, your eyes glaze over. You're like, oh, those guys are talking about that stuff again. It's just a bunch of twiddly bits I don't have to worry about. Well, that's the first thing we say is not the right way to think about it. APIs are products, just like any other product that you might buy. And so we have this thought process. And again, this is what we're all in on, to say, as products, how do we get people to think about APIs as a way to drive innovation? You drive innovation by buying that product. You buy that product because you trust it. And because you need to get to that trust, we need to make sure we understand how we communicate this to you in every way. So this research that we did really was really trimodal. It covered all pieces of the ecosystem. We talked to providers, we talked to payers, and we talked to the digital health ecosystem. And what I personally found super fascinating about this was the commonalities in some of the challenges that everyone had, even looking at the problem from the 3 different lenses, but also from where the opportunity lies to connect everyone together in new and meaningful and interesting ways. So based on what we saw here, right, the strategic importance of APIs could not be more clear. The regulations tell us this is a necessity. We have to go do it. Our patients, our members, our subscribers are telling us, guys, I want this. I want the best possible experience. And as you can see, that everyone thinks this way. And so there's no argument. We know that we have to be in a place to embrace APIs, to embrace the API first thought model, to embrace a new way of thinking about how we develop our solutions that will engage what everyone wants to get done. No argument there. But the maturity and the ability to ramp up in this way is very, very different. Providers, because they've been in this space for a while, are necessarily most mature. They're used to saying, yes, I want an API, give it to me as a consumer. Digital health companies, a little less. And I think this represents an opportunity. Not to say that innovation only happens in digital health, but this is a huge opportunity for us to think about from a different perspective. And I am going to tag Adam on this one 100%, because as someone that lived it, he was able to look at the process and say, I could do this better. This is a way that we can truly drive innovation, get digital health companies like PatientPal, like everyone else, to say, pick up these APIs and use them so I can focus on how I truly want to innovate. Now, what's really interesting in this research is on the other side. As a producer, there's higher maturity. I developed the APIs for myself, which is awesome, because then we're not convincing anyone that APIs are a bad idea. It's about how do we make them usable and make them go out into the world for everyone else to use. Because at the end of the day, the commons, the ability for all of us to have the right APIs to drive our experiences and drive our engagements forward is going to be critical. No one person has all of it. Very few people will have sufficient comprehensiveness, though, that you want to go engage in. And we'll talk about that in just a minute. And then, oops, I think I went to the wrong slide there. There we go. But what's preventing us from getting there? And I think the 3 key themes are security, security, security. How do I know that the data transiting this API is secure? It's not going to get leaked in the middle, and we're not going to end up on the front page of the New York Times or the Wall Street Journal. Is the technical infrastructure in place? How do I actually go engage with this? Can I use it? Is it easy for me to start up and start working with it? And then how do I use it? Right? Or am I just getting some code, or am I getting the instructions and all the things that surround it to make it easy to use? And this is fairly consistent across all 3, which we're not surprised by, but it tells us that there is a gap. There's a gap in engaging how to use APIs for innovation. And that means we have to help people understand how secure they are, how to use them, and to show them that they're performant, that the right infrastructure lives underneath. And then the benefits. And I think everyone's aligned on the benefits. But what we took away out of this research is ease of use. Number 1, it's got to be easy to use, because otherwise you're not going to want to use it. As a business person thinking about how to use the APIs to go faster, as a product person looking at how to accelerate your delivery to market, as a developer, how do I not have to rebuild things that already exist? They have to be easy to use. And the second point here is they have to be performant. You don't want to buy an API and then find out that it doesn't work, rip it out of your solution and have to put another one in. Kind of breaks the promise. So Think about that: security, ease of use, understanding of use, and ultimately the performance. These are things these are the gaps. These are the problems that we have to solve to make APIs more usable in the broader ecosystem. So I've talked to you a little bit about where the market's going, what are we trying to do, what's blocking us, and ultimately how APIs can drive innovation. Now, I'm really happy to pass it over to Adam here, because if there's a story about how a digital health company picked up the use of APIs, learned the lessons, and actually created, frankly, an amazing product. And by the way, Adam, I want to introduce you to the diagnostic imaging center I worked for, because I want them to use your product, not the one that they had, because this is how we create the experience that I think that we all want as healthcare consumers. So Adam, over to you.
Thanks, G. And I'll just say, I mean, I love you and I love working with Change Healthcare because we really do think about this problem very similarly. It's easy from experience to just assume that these numbers on the screen that's just the cost of doing business, or that's just how it works. I mean, as a front desk staff, it's after a few months and then years and then maybe decades, you get really habituated to the idea that you're going to be on hold every week for 9 hours of your life. With insurance companies, you become accustomed to this. I'm so glad you brought it up, because this concept of bad debt, I have never seen another industry that has so much bad debt flowing through it. I mean, that is a distinct, all of these problems, the cost of doing intake forms, the number of insurance rejections you get, everyone always says this in healthcare, but if any other industry operated like this, there'd be chaos. And it's very much the problem that you enumerated. It's this problem of fragmented data. I call it, in my line of work, I call it balkanized services. So, you have I do this, I'm your EMR, I do this, I'm your billing company, I do this. And it's like, nobody takes any ownership over the entirety of the process. That's why we started Patient Pal. I mean, in the beginning, a lot of investors and a lot of people wanted to put us into a category. Oh, you're my intake system. You're my patient engagement system. And the problem is that we need to stop seeing the world in this linear, fragmented, balkanized sort of system. We need to understand that it's the entire administrative process is one process. The entire medical or care process, as you said, it's one holistic process. And if you've worked in the job that you are automating or improving the technology around, as I have, you get that. Practice managers get this. CFOs get this. It's one process. So what you're looking at now is essentially a breakdown of what we see when we walk into a clinic. Front desk schedules, then you verify insurance, then the patient checks in, then you scan their ID cards, give them an intake link, then they check out, then you transcribe their intake into the computer, then you submit it just takes weeks, it takes people, and it kind of comes to this concept of bad debt. You're collecting weeks after the appointment. Patient Pal eliminates all of those problems. And I'm sorry to plug my product so much, but it really does. And it does so by the way you were describing. You, Change, have made it so our problem is not, oh God, how are we going to connect to every insurance provider in the country? Our problem is simply, how are we going to unite all of the data streams within this practice to Change's API so we can transact on this data? And that's what we do. So with Patient Pal, you schedule the patient the way you've always scheduled a patient. I don't want to change a single system that you already use. Then we extract that information and we have our own integration methodology. If there are people on this webinar who are saying like, yeah, right, they can connect to my EMR, BS. We have had to spend a lot of our experience innovating in how we integrate really well and really scalably. And that's what we've done very, very well. So we pull out all the data, we send the intake forms that are specific to that procedure or that patient's age, a number of logical factors. We pull their insurance plan through Change Healthcare. We figure out how much they owe by parsing the plan and basically aligning the benefits for that procedure to the negotiated or contracted rate that you have with that insurance carrier for that procedure to come out with what the patient is going to owe when they walk into the office. And then we communicate really well to the patient. So to your point, I think a lot of bad debt exists in healthcare because we just don't communicate well with people. Mm-hmm. I mean, again, I hate to do this because everyone always does this, but if any other industry, any other service provider, from my mechanic to the grocery store, if anybody ever communicated with me about how much I owe, the way most doctors communicate with their patients how much they owe, I mean, there'd be bad debt circulating around the whole world. So what we like to do is say, okay, now that we've done all of that work, we figure out, we know exactly how much they're going to owe, we know exactly how much you're going to get paid by your insurance carrier, then we communicate intelligently and affirmatively, proactively with the patient. We send them intelligent text messages that break down their bill. We explain their plan to them so they know what a deductible is and what a coinsurance is. Our intake forms change based on how much patients owe so that it prompts them to, enter a credit card. So we have one on file, knowing that we're not going to charge anything until the exact amount is known. It's about communication. It's about connecting systems, and it's about using APIs to connect to the outside world and tackle problems that are frankly too big for one company to solve. If you do a good job at this, if you do a good job at connecting all of these systems, as I believe we have with your help, then you should get to a spot that we've gotten to where everybody gets something, everybody wins. We oftentimes, I think, in healthcare, we think in this very unhealthy zero-sum mentality, where if the provider's making more money, then the payer and the patient is making less. If the payer is spending more, the provider and the patient are spending less. It's always this tug of war. When provider rates go up, insurance premiums go up. It doesn't have to be true. If you connect data really well and you communicate really well, what happens is patients have a much more transparent experience. Mm-hmm. They can shop, right? They can finally say, I don't want to go here because I have a $2,000 deductible. This person charges $600. This person charges $300. I'm going to go to the $300 provider. It's closer to my house. So collecting from patients and being transparent about it actually helps them, because now they know what they're going to have to pay and they don't get blindsided. Collecting what you owe is obviously good for providers, but spending less money to do that is really good for providers. It allows you to see more people and it allows you to spend less to see them. Payers benefit from all of this because they have very prescriptive plans. They want patients to go to specific providers that they've contracted with, in a customized and formal manner. Explaining to patients who's in their network, who's out of their network. This is all essential. So this is an important thing that I always kind of harp on. Everybody can win. If you connect systems well, if you communicate with people proactively, everybody can win. I hope I didn't go too fast, G, but anything that you want me to kind of touch on or harp on again, I will do so.
Yeah, well, no, it was great. And I think you hit upon a couple really key points here, right, in the use of the APIs. One is it's about connectivity. And so you don't want to have to build connectivity. You want to use connectivity that already exists because you have limited resources. You have limited time. You want to go focus on that great experience. You don't want to have to worry about, do I get connectivity to all of those insurance providers behind the scenes? Because if you wanted to do that, you would just spend all your time building connectivity and you wouldn't be building the great product that you're trying to build. So I think it's a really key point. And I think the other one, and it's always buried in this API conversation, is, well, what does that mean? I have to start swapping things out? Like I've spent my time, money, and effort to integrate a system. Now you're asking me to get another system? Kind of a non-starter, right? Well, not really, because the whole purpose of having the APIs in place is you leave the systems you have in place and you think about them as the intelligent integration. How do I connect the systems I have to the other systems that I have to, so that I can ultimately get to that great experience? And I think that's one of the things that you talk about a lot is, I'm not going to go into a practice and say, hey, rip out your EHR. Because, they'll kick you out the door at that point, right?
Completely.
So it's more about how do I create that connectivity? I think that's fundamental. Well, and that's a great segue into what we wanted to talk next, right? So I think Adam shared some really great insights about how they used APIs, how they're using the APIs that are available from Change Healthcare to be able to create this great experience, to reduce the friction of getting a patient to their diagnostic imaging appointment, to reduce the pain that the provider and the back office staff have to go through to actually perform that function. But that's the front end of the story. You've had experience here, Adam. So what would you tell somebody that's saying, you know what, I heard the webinar, I saw the regulations, I'm in, I want to go do this? What would you tell them? How do they get started? And most importantly, what would you tell them not to do? What lessons did you learn?
G, for the webinar, should I call you Gautam or G? What do you think?
Just say G.
G is good. Okay. I have a lot of experience here. I mean, our personal Patient Pulse personal experiences, we made a couple mistakes on the way up. We considered APIs to be more like a commodity, water or electricity or something to that effect. It seems simple. I need to connect to all of these insurance providers around the country. And a lot of people do it. So let's just start with the first Google result and go from there. A mistake, a complete mistake. This is not like water or electricity. These are tech products. The reliability, the ease of implementation, the ease of supporting these products and getting help is incredibly variable and incredibly important. So what I would say to someone is vet who you use. Don't just start plugging them in. I would, run a few queries on Postman or something to that effect. I would call them, and this is kind of a sneaky thing that people in my position do, but I would call them just to see how good and responsive their support system is before you need it. You know what I mean? Give them a call, see how fast they call you back or answer and how much help they give you. And you may not like that because you're going to start getting calls.
A ton of phone calls.
You don't need anything. They're just vetting you. But that's what I did. I would also plan for the future, G. So I would, in our case, we knew that the products we have today are not going to be the only products we ever make. So we wanted to work with someone that who we can grow with, both with pricing, as we grow, we want the price to come down, but also products. We don't want to work with 10 different vendors to do, 5 different things. We'd like to work with 1 or 2 to do 10 things.
Cool. So there's a couple of key themes I think I heard from you there. One is comprehensiveness, right? You want to be able to go with a provider that gives you more than just one specific API or one specific function. Trust. You want to know the thing works, right? And it works kind of out of the box. And really support. You want to know that you're going to create a relationship with this particular provider, and they're not just going to say, "Hey, here's a product. Hope for the best."
Figure it out.
But you're gonna have that partnership at whatever level is appropriate, so that you can continue using the products. That makes sense. If you think about in a scenario where you did not have access to the APIs, what would happen, right? And I think this goes to there's a gut question here from a lot of people that say, yeah, okay, yeah, it might have saved you a couple days, off you go. But if you didn't have these, where would you be today? And how did the use of the API actually let you do what you wanted to do?
Gee, that's a scary hypothetical. That's scary hypothetical. There's 2 options. If we did not have access to APIs that can help us connect with all these insurances, then our product would be limited very regionally. I mean, if even that, I mean, you can't do everything in healthcare. You have to choose, what is my space? What do I want to innovate in? And then you need to find whatever space that is, it's going to be connected to a whole world And you're going to need to find partners, change, et cetera, who can allow you to focus on that space and deliver a good product by connecting to the rest of the world. So you just can't do everything on your own. And a problem like, I keep using this because this is how we work with you, but a problem like connecting to all these insurances, that's much too big of an undertaking for a small startup. And we're talking about like 27 or 2,800 insurance providers that all have different formats, the way they send data, the way they receive data. It's a massive task. So what you've done makes it very easy for companies like ours, like Patient Pal, to innovate in our space. The simple answer to your question, if we didn't have APIs to connect to all these different insurance companies with the click of a button, we would probably be an intake product. That's it, right? Because we can control that ourselves.
Right. So it's really about, you became more comprehensive, right? You really made those right connections. Yeah, that makes sense. And it's really consistent. We hear this a lot as we can go into the ecosystem. We heard it in the research. We've heard it, from Adam. We've heard it from the other companies that we talk to in the ecosystem. Give me the tools that I need to let me focus on what I can do best, right? Adam and his team know how to do their piece of the world best, how to create the best intake process and how to create that best process. How do I do what I do best? I can run the claims and the coverage and the eligibility, right? And so the two of us together work really well. And so when you think about, as you go forward, hopefully we've given you the thought that says, you know what, this is something to look into, or, given the survey results, it's kind of hard. I need to rethink how I do this. How do you take that next step? Who do you work with? And how do you know that that's the right person to work with? And so the 5 things you see up here are really what we've come down to as we've had these conversations, of course, internally, because I spend as much time convincing our internal developers that this is the right way to go as I do with folks in the outside world. And how do you know? How do you get started? So the first thing to think about, and Adam hit this a couple times, comprehensiveness. How many people do I need to go to get what I need across my whole experience, across all the data that I want to connect to, across all the experiences that I want to go create? If I have to go to 4 or 5 or 6 providers, that's hard. And you're kind of breaking the model then, because you're doing the work of integration versus saying, can I go to one provider that has a pretty substantial set of APIs or API-like products that allow me to make these connections? So again, and you'll hear me say this over and over and over again, so you can focus on what you're good at, we can focus on what we're good at, and then the synergy between the two is how we get everyone out into market faster. Do you have the right level of engagement and support? And on one side, that's as Adam pointed out, does someone pick up the phone or send an email back when you send an email? But on the other side is, do they give you the information you need? And one of the things that we found is there's a lot of people in the overall ecosystem that understand their part of the ecosystem. And we've taken it upon ourselves to say, when you come and look at the APIs that we provide, it's not just, here's this one little tiny piece. We'll give you the educational material you need, the context, the information to understand, how does that fit inside the broader ecosystem? How do you conceptualize what you're doing so that you're taking a step out and saying, I got it, I'm going to use that one particular piece, but I understand how everything else fits together. Build versus buy. When does it make sense to buy something versus build it? And you know what? This is straight up philosophy. We could go on for years about build versus buy, but really think about what you're good at. And I'll tell you, this is the conversation I have with our internal developers constantly. Do you really want to go build that? Or do you want to go pick it up out of the catalog and use it? Because then you can go focus on what you need to go through. There are legitimate situations where you're going to want to build something, especially if it's something that you have expertise in, it's your IP, or it's the experience you want to create. Build that stuff. Buy the stuff underneath. Buy the APIs underneath that give you the connectivity, the data, the ability to get to the outcome so you can then focus on what you're really great at and build that. Security and trust. Security and trust. Without these two things, nothing else matters. Is the API secure? Can that be proven to you when you're picking it up and using it? Is it trustworthy? Can you say, yep, I'm going to transit patient data, PHI, through this mechanism and know that it's going to be okay? And one of the ways that we talk about it at Change Healthcare is because this API is a product, it's not just some twiddly bits of code that I put up on GitHub and say, off you go for the best. We treat these APIs the same way we treat our products. They go through the security scans. They go through dynamic and static scanning. We pen test the API. We make sure that it actually is what it says it is, and it transits information in the right way. Why? Because the first instance that we break trust here, whether with the people that are using our APIs or when the people that use our APIs have that break of trust with their customers, the system fails. So security and trust, can that be proven? Can you see that whoever's providing the API has a commitment to doing that the right way? And the last part is performance and scale. And seemingly, again, right, motherhood and apple pie, of course, but does it do what it says it does? And then does it do what it says it does at the scale you want to be at? I'll take Adam's example again, eligibility. Are you going to go and pick an eligibility API that works when you get to 100,000 transactions and maybe it slows down? Or are you going to pick the one that runs billions of transactions a year? Well, of course, you want to do the latter, because you don't want to have to go think about, is this thing working down in the depths of my product, or I have to go replace it because I hit scale? So think about these 5 things as you go through and develop your solutions. I want to use an API. I'm going to buy the things that are necessary and build what I have to that I can differentiate, and then buy them from a place that is secure, that gives you the support you need, that will work at scale, and ultimately provides you everything that you need relatively in one place. And so again, as we wrap up, I'll invite everyone to go to our API and Services Connection, which is our API developer portal at developers.changehealthcare.com. And you'll see how we've committed ourselves to driving forward the API as a product model, to enabling the ecosystem, whether it be hospital and health systems, whether it be payer organizations, whether it be digital health companies, with the kind of information they need to pick up the APIs, to try before you buy, to have documentation, to have a sandbox where you can build your whole application by testing it with some credentials before you get started, and ultimately a place where you can go across your life cycle. We've committed to this because we think it's the right thing. We think APIs will drive innovation across the ecosystem. We think that APIs are the key to breaking down the silos and ensuring that we can create the kind of experiences and outcomes that we all want to get to for our patients, for our members, and ultimately for our subscribers. And with that, I'll thank you, and I'll thank Adam for joining me on this really fun webinar, and I'll hand it back to Rajiv for some Q&A. Rajiv?
Great, thanks, G and Adam. Really an awesome conversation on the API and interoperability landscape. So much that we learned, and so much to continue to follow, and really an interesting conversation. We do have a bunch of questions that have come in from the audience, and I just want to take the time to remind the audience that you can submit a question now until the end of the program using the Q&A box to the left of your video window at any time. First question from the audience for G. One of the biggest issues in healthcare data is not just about the connectivity, but rather about data quality. Do you see Change Healthcare addressing the quality issues with its portfolio of partnering with developers of quality solutions?
Yeah, that's a great question. And so, first of all, the data quality is something that we think about every single day because, frankly, we operate in the data environment. And so we think about solving that problem really in 2 ways. One, when you are the pipe, you can then enable the quality filters in the pipe. So we've started by having that conversation to say, let's make sure the connectivity exists. And then on one side, can we ensure the quality of the data that we're able to transit, right? When you're using, again, the eligibility API, a claims API, an API that's providing financial information or patient data, it's our responsibility to ensure that the quality of the data from the input and the output ends not only are well documented, but are appropriate to task. And I will tell you, personally, I've had to have that hard conversation with our product teams and say, you know what? I love this product. I think the API is perfect. The quality of the output is not sufficient for the need. And we can't put that out for anyone to use when it's there. So that's one half of the equation. The other half of the equation is because we see ourselves as one of the enablers of the ecosystem, our ability to power that ecosystem allows us to form the partnerships with digital health companies, with the providers of those solutions, and say, how do we bring your data into the commons so that we can show better quality in that data? And you know, I think about examples like and these are going to be examples that are outside of the norm, right? SDOH is an example where there's so many sources of how to get that information. Personally generated health data, wearable data, same thing. The quality of the data is critical when it goes in the system to actually drive the outcome. And so we want to partner with people that can work with us with that high quality data so we can put it in the commons and then make it available. So I guess yes to both in a very long answer.
Great, thanks. One for Adam. How easy was it to engage with key insurance providers to provide the particular plans and the associated costs? And did you find the big carriers, how did you find the big carriers in terms of their support transparency related to costs?
It's a great question. It's something that change makes change masks how hard that is to really do. Through change, it's quite easy to connect with a number of carriers. The bigger ones are more reliable. So your Aetna, United, Cigna, Blue Cross, these are more reliable, they're more stable, and their data is a little bit easier to access. It's when you get to these little insurance carriers, these hyper regional guys around the country that are just very not API accessible. They're very tech regressive, if you will, that things get a little harder and connecting with them can become impossible. But for the vast majority, I would say 90%, 85 to 90% of the carriers that we encounter, change is rock solid with very little configuration to connect. The area that this is kind of a funny thing that I think a lot of people may or may not understand intuitively. Medicaid tends to be our biggest problem. Medicaid is state by state. Everybody has their own system. Different states are at different stages of their tech revolution, and that's where I see a lot of variance, and where some are hits and some are misses. But I would say 85 to 90% of insurance carriers, from the big guys to the middle guys, are all pretty easy. It's those small regional carriers that are just very tech regressive, and some of your Medicaid providers can be very tech regressive.
Great. We'll go to, thanks, Adam. We'll go to back to G for the next one. G, how do the APIs that we are discussing here differ and align with interoperability industry standard API?
Oh man, you asked me the question that'll get me off on a rant for an hour at least, but I'll keep this short, I promise. And so one of the things that we have to think about when we create APIs and we make them available in the ecosystem is, how do we engage with the standards most broadly? And so, you can think about the standards being X12. You can say that JSON or a JSON schema is a standard. And then you have FHIR. And I will tell you, I am a huge proponent of everyone jumping onto the FHIR bandwagon and using FHIR. I mean, to the point that we've obviously doubled down at Change Healthcare on enabling FHIR-based APIs, not just because of the regulations, because frankly, this is how we create a true interoperability standard across the ecosystem. And so to answer your question directly now, the APIs that are going to differ based on the capability of the standard. And so to the extent that we can use FHIR as the baseline for the APIs, we do so. And that's what you should be looking for in a provider, because that's the standard that we're going to carry forward. At least that's the standard that HHS and everyone have agreed to today. So we're going to carry forward with that. In some cases, we're integrating with a different standard. So there is an X12 alternate that you can use to submit API submit certain types of transactions, and we align to those. So again, it's going to depend, but the general answer is, to the opportunities we have to be standard, align to standard, and drive the standards, that's what we push into the APIs. And I don't know if the question here was asking specifically, for example, around the FHIR Patient Access API or the FHIR Provider Directory APIs, but when those APIs, which we make available in the developers portal in the URL that I shared with you, those happen to all be Fire. Our e-prior auth APIs, as they become available, are all part of Fire because they have to be to enable the kind of outcomes we want to.
Yeah, and like you mentioned, that Fire standard is being supported and propelled, of course, within these new interoperability regulations by the government. Thanks, G. Adam, next question for you from the audience. It is a little bit of a half question, half statement. Your thoughts on if it seems flawed to trigger payment based on the quote unquote exact amount known when this is incorrect most of the time in complaints going up to state regulators?
I think this is a very important question and something, it kind of goes back to something I was saying earlier around communication. You can't just collect money from patients or just say you're going to start doing that and not expect there to be refunds issued later, not expect there to be some degree of education to the patient about what is going on. So most patients are walking into your practice and they have no clue how their insurance plan works. They think, I have insurance, it's covered. These are conversations that everybody who's worked in a medical office understands. Communication to patients and creating the right collection workflow for you. I'll tell you what you can't do. What you can't do is continue to not collect at the time of service in any form or fashion and expect your financial situation to get better. It's not going to work. So, I mean, you can, and you're just not going to collect 70% of the money that you're owed. And if that's okay with you, that's fine. If that's not okay with you, then I would start to think about how can we communicate with people in an automated fashion that allows them to understand, okay, I am giving you my credit card and charging, let's say, half of what the expected amount's going to be. When they hear back from my insurance, or when I hear back from my insurance in a few weeks, I'll know I'm either going to get a refund for that half or they're going to charge the other half. I've seen people do that where, they take 80% up front, and then when they hear back from your insurance that it was correct, they'll take the other 20% or issue a refund. I've seen people just get a card on file and say, when we know exactly how much it's going to be, we're going to, send you an email or a text message that explains why, and then collect. There are tons of ways to skin this cat. And the good news is Patient Bell has a way for really any provider. I think, we're at about 200 clinics right now, and I would assume there's about 50 different workflows that people have customized in our software to best collect the money they're owed. Also, payment plans, financing, I'm not as positive about. I think that interest on medical bills is not necessary, but I think there's a lot of ways to skin this cat to prevent, complaints going to regulators. That's something that we should never have. And I believe it starts with communication. You just should not sacrifice your financial well-being because you're scared of doing your job.
Yeah, really interesting. Thanks, Adam. G, do you believe that APIs are sufficient for large data exchange? And can you kind of explain the nuanced layers there?
Yeah, absolutely. And so, the obvious answer is yes, they are, but it depends on how the API is designed. And of course, if the person that's thinking about that API design has thought through it and built it that way. And so when you think about, for example, what CMS has asked us to do with the interoperability and patient access rule, it is quite possible that large data packages are going to be sent from the payer down to a third-party provider. One of the really key things that we had to think about in developing that API product is, what does that scale look like? Right? If the requirement is I have 24 hours to go get that data, which is going to be fairly large, right? Because it's not going to be just for one member, it's going to be for thousands of members. Put it into a central location, and then parse it, and then pass it down via the same APIs to a digital health company. Yeah, that is absolutely a very typical, understandable API transaction. and one that would be appropriate in, when you think about large data exchange. The other piece then, though, is, again, you have to think about it from a design perspective. If you don't design the API well, or it's not built on the right infrastructure to support that scale, it won't work. So long answer, yes, they are, but you have to think about them that way. And you should ask your API provider, what is the scale that you've tested to with this API to ensure that it actually meets your need, both today and then as you continue to grow?
Great, thanks. Back to Adam, could you talk a little bit about how long it took you to implement and some of the timeframe concerns or issues, if there were any?
Yeah, I mean, I think, I want to speak to the providers on this call or on this webinar. If there might be, first, a short answer to your question. Us personally, PatientPal, when we built this product, your product, into our system, we were a much younger, much smaller company. So that's kind of the first asterisk. It's a direct reflection of how many developers you can deploy to this project. So we had a relatively small team, and it took us between 1 and 2 months. I will say that it took another month or so to kind of get it to production level. And if we were doing it now, it would probably take, at least, at the most, it would take half that time. But this is a kind of a good reason why I want to speak to the providers on this call and say, you don't have to hire developers to build these APIs into your practice. That's basically what PatientPal is for. We sit between, you can almost think of it, sometimes I describe it as, change to me is the cable, it's Comcast. It's laying the infrastructure in the community. And then companies like PatientPal take the signal and connect it to your home. That sort of last mile of the process. So we're a technology company. Took us about a month, maybe 2. And I think for a company like us now, it would take 2 to 4 weeks at the longest. But you should also know it was like the third company that we worked with to do this. So the first 2 companies, we never really finished the implementation because of the way that they were built was so poor, for lack of a better word. They were so difficult to work with that we never were really able to. I'm hearing for change, they are so well built that it only took us, about a month or 2.
Great. I think we'll close with one. Thanks, Adam. I think we'll close with one more for G. It's an important question around privacy and security. What can be done to ensure privacy and security with APIs?
Yeah, it's trust, right? It gets down to that core item of trust. And so when you think about the APIs first, you have to build privacy in. You don't bolt it on, because you're really thinking about the core data flows. How am I securing the ingest? How am I securing what's happening inside the API? How am I securing out of it? And so your provider, the person that's building that API, really needs to think about what is necessary to ensure. And this is beyond, of course, it's encrypted in REST. Of course, it's encrypted in transit. I mean, that's basic security. How are you ensuring that the data that's coming through the pipe can't be read in inappropriate ways? How are you ensuring that the data that is going to be egressed can be egressed in the right way? So it's a design consideration. That's your first step. And then the next one is it tested? Can your API be tested and proven in a way that is actually secure? So are you doing static and dynamic scanning on it? Are you doing penetration testing? Are you doing what you would typically do for a product to do that? So you ensure security and privacy first by building it in, and then providing the ability to validate it through independent testing or independent means. And as I shared before, this is exactly how we think about our APIs. This is what you would do for a product. You wouldn't put a product out in the world unless you could say with certainty to your subscriber, your member, or your patient that your data is secure and the experience that is being delivered by the data is correct. And you do that through, again, building it in and testing. And so that's how we do that for APIs.
Great. So that is all the time we have for today. We're at the top of the hour, but I'd like to thank once again G and Adam for today's excellent and insightful webinar. Of course, I'd like to thank our sponsor, Change Healthcare, for making today's program possible, and also to Patient Pal for joining us for the program. Finally, I'd like to thank everyone in our audience for joining us. We really hope you'll join us in the future for another healthcare innovation webinar. And with that, this concludes today's presentation. Thanks again.